Hello friends, welcome back to the Healthcare Today. Today we are going to discuss about hemoptysis. Hemoptysis is called coughing up of blood. So many times you see your neighbors coughing up of blood and there is a lot of panic situation happening. So most of the times you can divide this hemoptysis into two types, whether it is associated with saliva or whether it is associated with an expectoration. So usually when it is associated with saliva, that means the problem is in the throat. You can see people having recurrent sore throat, whereby the patient tries to remove this stimulus, that there is something stuck in the throat. So patient tries to do and all these things. With those things, patient's the blood vessel inside the throat, it slightly erodes and leaves the blood out. So that is one of the most common reason why there is hemoptysis from the throat. There are other few causes where you can see hemoptysis associated with blood, associated with sputum. When the sputum is there, it is indicative that the problem is in the lung. We are discussing four common causes where you can see hemoptysis these days. The foremost reason is pneumonia, whether the pneumonia may be due to bacterial, viral, fungal or tubercular. These are all these four causes. Depending upon the extent of severity, you can see hemoptysis. And the second most common cause which we see is bronchiectasis, which is also called abnormal dilation of airways. The most common reason for bronchiectasis is whether a person had a childhood pneumonia or he had tuberculosis in the past, that leaves a sequelae inside the lung. Thereby the airways at times dilated, at times tortuous. So when there is no uniformity in the airflow, there is a chance that bacterial infection happens. Usually what happens is patients have cough, expectoration, fever and at times hemoptysis. Once he visits the doctor, he gives medicines and all the symptoms are subsided. Patient will be alright for few days. After that there is a repeated infection again all the symptoms come back and he visits the doctor. After medication, patient will be alright. The patient will be in the same cycle with bronchiectasis. This is very common. Most of the patients, Indian patients, do have bronchiectasis, especially after tuberculosis. This is also called post-tubercular bronchiectasis. And the third most common cause which we see is cancer. When there is a tumor which is associated or closely associated with your airway, then the tumor erodes the upper airway or the mucosa of the airway, thereby the vessel gets involved, thereby leading to hemoptysis. So out of all the three causes which I discussed, this is the one cause where you need to be very attentive. Visit the pulmonologist at the earliest, see the location of the tumor, get a biopsy, and as early as possible you can start the treatment. These days cancers are also curable. The fourth common cause, which is increasingly seen over the last few years after COVID, is pulmonary embolism. Pulmonary embolism is defined by presence of clots in the lung. So these clots usually generate due to lack of activity, people who smoke and people who have varicose veins and deep vein thrombosis. There is clot in the larger veins of the legs, and this clot travels all the way through the inferior vena cava and gets dislodged into the lung. Once dislodged in the lung, the patient has cough, at times hemoptysis and disproportionate breathlessness. Patients will be hypoxic at times. You can see bluish discoloration of fingers as well. So once there is a pulmonary embolism, once there is hemoptysis, patients will be invariably hypoxic, and this is one indication where hypoxia is not seen in other three causes which I mentioned. When you find patient having hypoxia and patient having hemoptysis, that means do suspect pulmonary embolism, and the treatment is very simple. Once we start blood thinners, the clot gets dissolved and patients will be relieved of his symptoms. In the next video, we are going to discuss about all the four causes in detail. Till then, we care about you.